Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. Hello and welcome to the 113th episode of the Eat Away Kidney Stones podcast. As always, I'm your host, registered dietitian and kidney stone expert, Melanie. And today I am thrilled to welcome yet another very special guest to the podcast. Her name is Erin Lenihan, and she is a pelvic floor physical therapist that I actually worked with after I had twins about 3 years ago. You may remember that back in episode 95, I had another pelvic floor PT on the podcast to talk about bladder health and how we as people who are trying to prevent kidney stones can handle large amounts of water without peeing all the time. And it was a fascinating episode and everyone loved it so much. I was so excited to welcome yet another pelvic floor PT to talk a little bit more about pelvic floor health in general, because I think that this is something that honestly probably everyone could benefit from, but people with kidney stones specifically, because people with kidney stones oftentimes don't just have kidney stones. Oftentimes we have constipation or are managing other health conditions that require medications that cause things like constipation or pain or bladder issues, or like so many other things. And so I think this is just such an fascinating area of study and of practice that I don't think many people know about. And so I am thrilled to use this podcast to kind of help bring awareness to what pelvic floor PT can do and how it truly can be life-changing for so many people. So please help me welcome Erin to the podcast. Oh, and welcome to this episode of the Eat Away Kidney Stones podcast. As always, I'm your host, registered dietitian and kidney stone expert, Melanie, and I am thrilled to welcome another pelvic floor physical therapist to the podcast, Erin Lenihan. She and I actually worked together. I was a patient of Erin's a long time ago now, right after I had the twins. I talked a little bit about this in the episode with Bianca back then. If you're interested in pelvic floor and bladder health, Bianca and I talked a ton about that in episode 95. I talked a little bit about how pelvic floor therapy, like, honestly made my pregnancy and post-pregnancy like a gazillion times better. And I am just like, I talk to anyone who will listen about how amazing pelvic floor PT is. And so I'm thrilled to welcome Erin to the podcast, especially since she and I did work together quite a bit after my pregnancy to help get my body back to normal, because turns out having twins and going through a vaginal and C-section birth like does a lot to your body. So so anyway, Erin, welcome so much to the podcast and thank you so much for taking the time to chat with us.
No, thanks for having us. I know Bianca was super excited to be on here before, and I've been looking forward to this. I think hearing that you have been spreading the word makes my heart soar, because I think it's a thing not enough people know about. So any opportunity I get to talk to people about it, I'm like, please, if you'll listen, I'll talk.
Yeah, seriously. Okay, and we'll talk more about that. But before we dive into everything, can you share a little bit more with everyone about who you are, what you do, and how you got here?
Yeah, absolutely. So my name is Erin. I am originally from Chicago. I went to the University of Michigan for undergrad, and there I studied movement science, and I was very much on a pre-PT track. Actually got interested in physical therapy by having an internship in pediatrics, and I quickly discovered I was not meant to be in pediatrics, but I loved rehab. So I went to physical therapy school at Northwestern University, came back to Chicago, and it was in PT school I learned about pelvic floor physical therapy. I had done, I'm not kidding, probably 200 hours just shadowing PTs to have a very competitive PT school application, because I'm that type of person. And no one had ever mentioned it to me.
Yeah.
So when I got to PT school and I heard about it, I was like, well, this is crazy. I kind of thought I was really deep in the profession. And at that point, I did a lot of projects, some more shadowing in pelvic floor. I loved it. And I did one of my clinical rotations as a student with another pelvic floor therapist, learned directly from her, which was amazing. And then ever since I've graduated PT school, I've been treating people with a variety of pelvic floor disorders. I still sometimes see like your normal kind of orthopedic PT case, but pelvic floor is definitely my passion. So that's where I spend most of my day. Yeah.
Yeah, that's amazing. What is the difference between like a normal, if you will, PT and a pelvic floor PT?
This is a great question. So in physical therapy school, you should, but I did get really great education on like the physiology of like your bladder and bowels. So like any PT is going to have like a really good understanding of how that functions. And then you're going to learn the anatomy of your pelvic floor. So your standard PT coming out of PT school is going to have an idea of like what your pelvic floor is and what it does.
Hmm.
Somebody who's trained in pelvic floor rehab has additional education outside of PT school and how to properly assess those muscles. That is not standard in
Hmm.
PT education at this time. So, doing an internal vaginal or rectal pelvic muscle assessment is something you learn outside of PT school.
Hmm.
And then proper treatment. So, then you learn
What
how
to
to
do
assess
about
those
it?
muscles. And yeah, if you find
Yeah,
something weird, you're like, what do I do about that? So,
right.
that would be like the main difference.
Okay.
Yeah.
Is there an official certification or like credential that people could look for if they're trying to find a pelvic floor PT who really knows what they're talking about?
This is a fabulous question. I wish there was something that was a little bit more
Clear cut.
standardized, like one thing
Mm.
you're looking for. But I will often tell people if, it's somebody I know who's not in an area where I can recommend someone I know personally. There are two main companies that do the pelvic floor education training.
Okay.
One is called Herman and Wallace. The other is the American Physical Therapy Association, the Academy for Pelvic Floor Physical Therapy.
Okay.
Um, those are the two companies you'd receive your training from. So both of those websites, which we could link to if you do that, have like a find a practitioner function.
Cool.
And in general, if you're looking at like bios on people's websites, if they will say I've taken courses with Herman and Wallace or the APTA.
Okay, that is super helpful. And I can definitely link to those two
Oh,
websites, especially if they have that find a practitioner, function, which is amazing. Okay,
yeah.
awesome. Okay, so backing up a little bit, what in the world is your pelvic floor like to start with?
Great question. Um, so anatomically, if we like start there, I should have brought my little like plastic pelvis down with me actually. Your pelvic floor is 14 different muscles, and when like we learn the anatomy, you learn it in five different layers.
Okay.
I often explain it to my patients because that doesn't necessarily matter for the average person to know all of that. Is you can think of your pelvic floor in like two different groups. You've got your outer pelvic floor muscles. Um, if you were looking at your genitalia with a hand mirror, you can like really visualize what those muscles do. They mostly like close and open
Okay.
all of the openings in your pelvis. And then you've got your deeper pelvic floor muscles. You'll often hear that called your levator ani. It's just a name that group of muscles get because, again, if you went really deep into the anatomy, it's a bunch of smaller muscles. But your levator ani, or that deeper muscle group, provides more like support and stability through your pelvis. Of course, it all works together, but it is really just a group of different muscles connected by fascia.
Hmm.
And fascia is just connective tissue that doesn't move in and of itself, but it kind of surrounds every muscle to make sure it can like slide and glide well.
Okay.
So sometimes masseuses or PTs will say they perform myofascial release,
Mhm.
and that's what
Heard
we're
that
talking
word.
about. Yeah, not
Yes.
just like the muscle itself, but also all the stuff that keeps the muscle together.
Okay.
Do you want me to keep going?
Yeah, definitely. If
Right.
so, why is it so cool? Why do we care about our pelvic floor? Like I feel like probably
Yeah.
most people haven't thought about it.
Yeah.
But I've learned so much just from being a patient and now the podcast that I'm recording. There's like a zillion different things that it does. So give us like a high level, why is the pelvic floor so important?
There are a zillion different things that it does truly. I think the pelvic floor is so cool because it is a very small muscle group. Like we're talking about like pretty small muscles
Yeah.
that play such a big role. So kind of broadly, there's kind of like a mnemonic almost. People will say like your pelvic floor controls the five S's. So the
Okay.
five
Love
S's
this.
are the function of your pelvic floor. So you have sexual function, sphincteric function, which is just like a fancy
Pooping
way to
and
say it
peeing.
helps you toilet and not toilet
Yeah.
when you don't want to. Stability, support, which I'll talk
Okay.
about how those are a little bit different in a second.
Okay.
And the last one is sump pump, which sounds terrible, but because your body weight and fluid falls with gravity, you can get a lot of pooling of blood and lymphatic
Hmm.
fluids and sometimes swelling in your pelvis. And so your pelvic floor is really important because it helps pump all that fluid like back up to your circulation.
That makes sense.
So less
And
glamorous
that's
function.
hard in pregnancy, I imagine, because when you said that pressure, I immediately like had PTSD. Like, oh my gosh, I remember that feeling
Totally.
so
Yes.
well.
Yeah. And postpartum, like especially when
Yeah.
you have a vaginal delivery, like the amount of swelling through your
Right.
pelvis. I mean, it's quite uncomfortable. So you
Yeah.
really need those muscles to help like work really like pumping things out back
Yeah.
into your circulation.
Okay. So many different things it does for
Yeah.
like quality of life. So, okay, you said you were gonna explain a little bit the difference between
Yes.
support and stability.
Yeah. So support is really like if you think of like a Halloween skeleton and you
Hmm.
see like its bony pelvis, it's just like a hole right through
Yeah.
it. If your pelvic floor wasn't existing, really everything would fall through your
Not
pelvis.
great. Hmm.
So, right, that sounds super scary to people
It's
too
not
when they hear
good.
about things like pelvic organ prolapse, which means
Yeah.
one of the pelvic organs is falling, typically through your vaginal canal.
Hmm.
Um, so that is support more so. Your pelvic floor actually like supports those organs, keeps them lifted, keeps them up inside your body.
Hmm.
Ability can have a bigger role in like back pain, hip pain,
Hmm.
SI pain. It actually stabilizes the joints that surround your pelvis.
Hmm.
So that's kind of a difference there. People will often ask like support versus stability. It supports your pelvic organs, it keeps them lifted, it stabilizes your pelvis as a system and a joint that moves quite a bit.
Yeah. And you don't really think about it very often, especially if everything's working fine. But like your pelvis slash like your hips, like everything connects to that. Other than like your
Yes.
arms, I suppose. But like literally everything kind of like connects to that central location on your body.
Yeah. And every time, I mean, when you take a step, there's not a ton of pressure, but every time you jump, every time you run, every time you hop, all of the pressure of your foot hitting the ground goes through your leg and through your
Hmm.
pelvis into your trunk. So your
Yeah.
pelvis is a very important, like load bearing structure. It takes a lot of force from like all the things we do as humans since we don't walk on our hands, we only walk on our legs. So your
Yeah.
pelvis is responsible for transmitting a lot of force.
Yeah. Anything else? Was that your
Oh, I
overview?
think that's
Okay.
like a good kind of overview.
Awesome. And so, since there are so many amazing things that your pelvic floor does, why in the world are there not more pelvic floor PTs? And why is this not like well known? Like, what's going on here? Like, I talked with Bianca, like, this is not like weird complementary alternative medicine. This is like standard of care. Sort of like, I feel like it's very similar to nutrition, honestly. Like, what I'm
Yeah.
doing is not weird. Like, this is literally like proven therapies. Yet patients do not get referred to us, much to our dismay. But like, why? Why? What's going on
Yeah.
there?
Oh man, what a great question. I think, I mean, a huge part of it is transparency. I feel like a lot of people still don't know it exists. I have found, and I would say we at the clinic Bianca and I are at right now, almost all of our referrals are through word of mouth. When people start
Hmm.
talking about these things, they're like, that also happens to me, and I wish it didn't.
Yeah.
I think, some people might be uncomfortable bringing up some of these issues to a medical provider. And then sadly, sometimes they do and it gets ignored. I think transparency is a big thing, whether it's us advocating to physicians, hey, this service exists, their insurance will likely pay for it these
Hmm.
days, refer them to us, or just to, human beings themselves being like,
Yeah.
all of these things aren't necessarily normal. You can get help for that. Um, and there has been a big, will just plug, kind of structural shift that's been really positive for pelvic floor physical therapy.
Okay.
In that, I started really doing a lot of pelvic floor PT in like 2019. And even back then, there was a lot of pushback from insurance companies that they wouldn't cover certain things. A great example is most insurance companies broadly will treat incontinence. If you're leaking, they're like, yeah, that's not right. Not all insurance companies, especially even, 5 or 6 years ago, would pay for pelvic pain.
Mm.
Viewing it kind of like, let's say you had pain with intercourse. They're like, well, that's not an activity of daily living. You don't have to do that to survive. And there has been a lot of petitioning at the legislative level. There have been
Hmm.
lawsuits that have really like shifted that. So I think
Okay.
that's helped a lot too, because unfortunately, if you're not getting paid for something, people don't really want to provide that service.
Yeah,
So
it just doesn't work.
right.
We
So
have to get paid for our time, turns out.
yeah, so a lot of PT clinics historically were like, well, I don't know if we're going to like lean into this pelvic floor thing. We're not going to get reimbursed for it.
Hmm.
That is happening more broadly and a little bit at a better level. I think we have, at least in Chicago, seen definitely a growing amount of people spending the money to get trained, learning these techniques, and then
Hmm.
offering.
Yeah, that's awesome. I have to imagine this is me being a little cynical, but I feel like most, and this leads up right into my next question actually, but most of the issues around pelvic floor, pelvic pain impact women more. And historically, women's health conditions are not really prioritized. So I'm sure that that was sort of, it
I
has
completely,
been and continues to be part of the issue.
yeah, definitely.
Hmm. Yeah. All right. So my next question is, I know that pelvic floor PT is not just for women, it is for
Mhm.
men and women. So can you, I feel like my brain, and I think most people's brains, I'm biased, obviously, goes to like pregnancy, like pre and post and like pelvic floor PT, but there's a gazillion different things like we just learned about that the pelvic floor does. So like what are the most issues you might see a man for in pelvic floor PT?
So, one benefit to having like male anatomy, especially like in the genitalia, is like the just anatomical design there makes it a lot less likely you're ever going to leak. And I think in general, that is what we see most as pelvic floor therapists is urine leakage.
Okay.
It is very common after
For men
pregnancy,
and women, you would say.
um, mostly for women.
Okay. Hmm.
And so I was going to say that is why then people assume men don't have pelvic floor disorders because they think pelvic floor problem means you're leaking and men don't really leak. And that's generally true.
Hmm.
So that's where I feel like this bias comes of like, well, men don't need it. But men absolutely, at the same numbers, most research would say, experience pelvic pain. That can be pain with cycling. I've seen that a ton, like bike seats, tailbone
Yeah.
pain,
Yeah.
sexual dysfunction, pain with sex. All of those kinds of things men experience at the same frequency as women. So that's
Okay.
something that again people like don't know or assume, and a lot of people are maybe not talking about, but that's something that is pretty level, side to
Hmm.
side. Constipation definitely disproportionately affects women if you looked at the literature, but men get
It's not uncommon
constipated. Yeah, so
at
like
all.
that's like a thing they definitely could come to pelvic floor PT for. But I would say what I actually see the most of in terms of men coming to pelvic floor PT is pre and post prostate surgery.
Oh,
That
okay.
actually greatly influences your bladder function. Almost all men who have either a prostate removal or some sort of radiation that shrinks the size of their prostate will experience leakage and issues toileting. So that is where I have in my practice seen the most men get referred to and feel open to walking in the door.
Hmm.
I think there's a lot more out there who probably need some help with, other stuff, pain included, but we haven't captured that population as
Yeah.
well yet, I feel like.
And men, and this is not just me stereotyping, men don't go to the doctor as much, are not going to complain. It's not complaining, it's actually just bringing up issues
Yeah.
about things. And I feel like, especially with this sort of sensitive area, that sort of has to be part of that story, I'm sure.
Yeah. Hmm.
Yeah. Okay. So we kind of got into like the science of what the pelvic floor PT is and like the five P's, but like tangibly, like what are some symptoms that would be red flags for you to a listener on this podcast of like, oh yeah, like you should definitely go see a pelvic floor PT.
Yeah. I think um, a big takeaway I hope people get from our conversation if they're listening is especially if you have like a chronic condition or if you have like other background health stuff going on, a lot of people will ignore some of these symptoms. Well, of course, I'm always going to do X because I have Y. And some of that might be true. Different medications you're on might make things function differently. But a big thing I encourage people to do, and I'll talk about some of the symptoms in a second, is to think if you have two or three of these symptoms, that's a sign that the system of your pelvic floor isn't
Thumbs up.
functioning properly.
Hmm.
If you had one, or maybe even two, it could be a symptom of something like background noise in your body or a medication you're on or something like that. But having, two, certainly three is more so telling us like something is off about the way your pelvic floor is moving.
Hmm.
In the bladder, things we look for that are atypical: urine leakage,
Not supposed to happen.
urgency, yep,
Nope.
urgency and frequency. So in general, if I'm just generalizing, people should be not using the bathroom more than every like 2 hours.
Hmm.
So people who go every hour, people who go every 30 minutes, people who feel like they can't make a car ride, that is a treatable symptom of pelvic floor dysfunction. And pain with toileting at all, whether that's
Hmm.
urinating or having a bowel movement. Constipation, pelvic floor PT can help a bunch with. Pain with intercourse, pain with orgasm. I'm trying to think of other ones. And then generally pelvic pain outside of sexual function. So if anything around your pelvis hurts, your tailbone, your sit bones, your pubic bone,
Hmm.
anything like that, sometimes a more traditional orthopedic PT might be able to help with. But because that gets so close to the pelvic floor, oftentimes that ends up being referred to or kind of ends up in our bucket.
Hmm.
I think those are most of the big ones. We mentioned this briefly earlier, but pelvic organ prolapse might be the last thing I forgot. If you, especially for women, it doesn't really happen in men as often, even though you could have a rectal prolapse. But if you felt heaviness vaginally, or you could actually visually see something falling out vaginally, that is a really common symptom of pelvic floor dysfunction that we can treat.
Yeah. Does that happen just from other than post pregnancy? Does
Mhm.
that happen just because of a super weak pelvic floor? Like what goes on there?
The biggest contributor to people getting a prolapse, if we're looking outside of people in childbirth,
Yeah.
is poor pressure management, which really comes down to like faulty breathing, and having a heavy load. So it's something that happens a lot to people who do like very heavy weight training,
Mm,
Olympic weight
I
trainers,
see that.
CrossFit athletes.
And like literally pushing, like,
Exactly.
okay.
Yeah, it's a strategy to hold your breath, to push huge amounts of weight because it does help you accomplish that goal. But then
Yeah.
you're putting this huge demand down on your pelvic floor.
Interesting.
Um,
Yet another reason I do not lift weights.
yeah,
Not, I mean, a lot of weights. I can do a little weight, but
right. Yes.
yeah.
Yeah. Love resistance training. I am so
Yes.
pro resistance training, but at a certain level of weight, it gets,
Yeah. Need to
you
listen
really
to your
need to
body, right? Too
properly
much of a good
train.
thing.
Yeah, totally. And the other one is chronic constipation. So
Okay.
similarly,
Mhm.
sitting on the toilet for a really long time, being red in the face, trying to really strain to push a bowel movement out, can give people symptoms of prolapse.
Okay. Fascinating.
Yeah.
That's a great segue into my next question, which is
Yeah.
constipation. So in episode 95, Bianca and I talked all about everything bladder and urine, which I think has an obvious connection to people with kidney stones since we're trying to drink so much water. But I also, in my content, have talked about how important gut health is for kidney stone prevention, surprisingly, through fascinating ways. Those little bacteria do so much for us.
Yeah.
And I do think that there could be harm in being constipated, obviously from a general standpoint, but also from a kidney stone prevention standpoint. And so I really wanted to pick Erin's brain about what we can do from this functional, PT standpoint to help with constipation because it's first of all miserable to be constipated. It's very uncomfortable and it really is doing harm in many different ways. And so can you like what can we do if you are constipated? Obviously, we can drink a lot of water, which we should be doing for stone prevention anyway. We eat
Yep.
enough fiber, blah blah blah. But like other than that, like what else can we do?
Yeah. So I love as a PT is all about like functional things. Like what can we get people doing? Like what can we actually change? So I think like two things that if somebody was listening to this and they were like, I trend towards constipation or I am chronically constipated, that
Hmm.
I would be like, you could start doing right now, even though you've never seen a pelvic floor PT before. One is breathing while you're trying to pass a bowel movement. So
Okay.
that is what we were just talking about.
Hmm.
If you are really holding your breath, you're like red in the face, you're like really trying to get it out. Um, you might be successful in toileting, but you're going to really irritate your pelvic floor in other ways that then you got this short-term gain of you finally got this bowel movement out, but potentially creating long-term issues from like straining and irritating your pelvic floor. So oftentimes I will tell people just make sure you're breathing. If you don't know how to do it, just like make sure there's air coming in and out. You don't go purple in the face. That's a great place to
Yeah.
start.
Deep
Um,
breathing, does it matter? Like just breathe, obviously. But like, are we talking like mouth breaths, nose breaths? Like, would you have any
yeah,
recommendations there?
there is some good research to say that like low level humming, so like not high
Oh,
pitched, very low pitched humming is
okay.
the best thing you could do. So that would be like one of the first things I would say. Either closed or open mouth is trying to create like, a low little like ooh noise when you're trying to push.
Okay.
And there are a lot of other pushing techniques that we will teach people when we're doing like internal pelvic floor therapy that are like harder to describe unless you were with somebody.
Mm-hmm.
My initial things off the bat are like just breathe and thinking of like low level humming tones.
Mm-hmm. Okay. Fascinating. All right.
Yeah,
So breathe is number one if
breathe.
you can't poop. What's number two?
Yes. Number two, I people know the term, so I'll say it. Get a squatty potty, but it does not have to be a squatty potty. I'm not sponsored by Squatty Potty,
Yeah.
unfortunately. But when you are having a bowel movement, your feet should be elevated so that your knees are higher than your hip crease. So that may look different for people depending on their toilets and their height. So you
Mhm.
might have to play around with it. In America, we trend towards really tall toilets.
We
So
do.
you might need something
As a
pretty
short
tall.
person, sometimes that's a real problem.
Yes.
Yes.
I'm a tall person, so I don't suffer as much, but I can imagine. So that is the goal, is like your feet need to be on something, but it only is helpful if your knees are higher than like where your hip crease would be.
Okay.
And what that does is there's naturally a kink in your pelvic floor, in the posterior pelvic floor, the anorectal muscles that keep stuff in. And so when we are seated, in like kind of like a normal sit or we're standing, like in everyday life, that kink is there to make sure we don't leak.
Mhm.
So then when you're trying to pass a bowel movement through that kink, you are just creating one more thing that's hard to get past. So if you're already having like firm or rocky stools, if you're struggling with some of like the GI management of things, I think this is the perfect example of me meeting someone and they're like, well, I'm always going to have this problem. I know I have IBS. I know I have X thing. And it's like, okay, so we know like stool consistency management might be tough for you. At that point, I'd also be like, have you seen a dietitian? But I'm like, okay, even if that is challenging, what can we do to make this gentler and better? And
Hmm.
getting into that squatty potty pose naturally kind of undoes that kink. So there's like one less hiccup in the road.
Hmm.
Um, so that is another one of like my immediate plugs the minute I meet somebody and they mention constipation.
Yeah. Yes.
Yeah.
It's life changing. I got
Yes,
one when I was
it
pregnant. Yes.
is. Yes.
You
Yeah.
once you
And
have one, you'll
then
never go back.
if you ever have the experience, I was in Thailand and Taiwan last year,
Oh,
and most of their toilets are just designed that you are like squatting the whole
yeah.
time. And I'm like, this is so fascinating that we just completely ignore this thing that comes very naturally to a lot of other cultures.
Yeah, that is interesting. Um, so okay, side note on squatting. So Bianca and I talked a little bit about how when you're peeing, at least you shouldn't
Mm,
hover, because
totally.
you're clenching, but
Mhm.
squatting is okay for both pee and poop.
Yeah. So if you were in like squatty potty pose, let's
Hmm.
say, especially if you had female anatomy and you peed, there's nothing bad about that because you're still fully supported. Your butt's
Hmm.
on the seat, your feet are on the squatty potty. You're not going to get that like hovering to keep you in space effect.
Hmm.
Um, it might be messy. It is for a lot of people. So you don't need the squatty potty just to urinate.
Yeah.
In general, sometimes I will tell people to do the opposite if they're having problems peeing. I don't know if you and Bianca
Mm,
talked about this at all, but sometimes
didn't.
I'll have them experiment with like leaning forward, like elbows on your knees.
Hmm.
Sometimes that can be like a similar idea of the squatty potty for the bladder, but it's not nearly as like profound.
Hmm.
But if I have somebody who's struggling to empty their bladder fully or struggling to start their stream of urine, sometimes I'll tell them to go in that direction.
Hmm.
Yeah.
Okay.
But no, because you're supported on the squatty potty, you could totally be in that position. Like I said, it might just get a little splash zony.
Okay. Yes. Which is never fun, but not going to
Right.
kill you. The third thing that we can do for constipation.
So, what I think is really undervalued when it comes to constipation management is activity.
Mm, hmm.
So, sedentary lifestyle is going to absolutely contribute to constipation.
Yeah.
And the more I work with people who have a variety of these symptoms, who come in who have a lot of symptoms, um, there is, underlying back pain. They do have an old injury. There's a million reasons why all of us can't move as much as we would maybe like to.
Hmm.
Um, and that is where PT can be really helpful because there are certain movements, twisting type movements, different stretches that can help promote a bowel movement. But in general, regular physical activity, walking, light cardio is one of the best things you can do if you're constipated. And if you're working with a PT, they can help counsel you on how to get into that. If you're somebody who hasn't been exercising regularly, what is like a safe and effective way to hop into physical exercise.
Hmm.
But also, if you're managing pain or some other symptoms that you're like, well, I stopped my walking program, I stopped going to Pilates because XYZ thing happened, like that is PT's bread and butter. We are like,
Yeah.
let's get people back to exercise.
Hmm.
That is
Just
another
moving your body, like however it feels
moving.
good. Yeah.
Totally. So that is another thing that I think might not be the reason people walked into a pelvic floor PT's door, let's say.
Hmm.
They just want to talk about the toileting stuff, but something that underlies so much of what we do because it's so important to like normal GI and bowel function.
Yeah. Yeah.
Yeah.
Such a good point and such an undervalued point. Like,
Yeah.
I feel like that's probably similar. Like that's a PT's version of a dietitian telling people to eat more fruits and vegetables, right? It's like,
Yes.
duh, but like could not be more important, like
But
just
like I
get
can't say it.
moving.
Yeah.
Yeah. Yeah. I was gonna ask you, and this is kind of a good segue into that, like, are there any exercises in general that you think are good for pelvic floor? Like, I seem to remember like child's pose is pretty nice for pelvic
Mhm.
floor, like relaxing, right? Or Kegels. How do you feel about Kegels? Like, what are like some general things that you might recommend to the general public for pelvic floor health? Or is there anything that would be
Yeah.
appropriate as a general recommendation?
Um, as a pelvic floor PT, I feel like it's so ingrained in me to not give like tons of like blanket things because one thing we have a ton of research on is most people are doing Kegels wrong. The way they think they're doing Kegels is not correct. And not everyone needs them. But there are a couple things that like everyone could do that could facilitate better pelvic floor movement and function. One of those is diaphragmatic breathing.
Okay,
That
tell
in
me
and of
more.
itself can be an exercise. Um, your diaphragm, so like if anybody's like watching, you can kind of see me. When you take a deep belly breath in, your diaphragm drops to like create more space for like your lungs to fill with air. So your diaphragm, which was previously sitting here, drops down. And if your pelvic floor also didn't drop down with it, there would be this great change of pressure in your trunk
Mm,
around like your visceral organs. So naturally, if you do like a really nice diaphragmatic breath, your diaphragm comes down and your pelvic floor moves with it.
mhm.
When you exhale, when the air is escaping, it all naturally comes back into place. So that's a great place to start if you're somebody who's like, I think I might have some pelvic floor stuff going on. I can't find somebody in network or in my area.
Mhm.
Or let me try and
Or
like,
or just want to make sure I keep things working, right?
yeah,
Mhm.
absolutely. Like preventative.
Yeah.
Totally.
Yeah.
That is a place I tell people to start with is like just work on some of your breathing and see how that feels to you. When you breathe in, can you feel your pelvic floor slightly open and relax? And that's true if you think of like your vaginal opening, but also true if you think of like your anus.
Hmm.
That's all pelvic floor. As you breathe in, can you feel that gentle opening and relaxation? And
Hmm.
then when you breathe out, it kind of just goes back into position.
Yeah.
So now you're already working to establish better pelvic floor range of motion. Um, and then on top of that, I would say any pain-free spine stretching is the
Oh,
next thing I would do.
okay.
Cows, child's pose you mentioned, rotations I love just because in general as humans and in our current lifestyle, we tend to be very restricted up here, forward shoulders, hunched over
On a
back, doing
computer.
my desk work.
Hmm.
Yes. And then that restricts all this breathing stuff I'm talking about. That
Hmm.
contributes to faulty breathing. So down the chain, really bad for pelvic floor.
Yeah.
So, laying on your side and doing a couple like open book twists, doing some like seated twists, rotations of any kind
Hmm.
are like my favorite. So
Yeah.
I would say like, yeah, if you can do it pain free, anything where you feel like you're stretching like your low back and mid back is what I would turn to.
Nice. That is my very favorite thing in yoga. At the end, there's often a twist, and my like just to like lay on your back and like put your knees up in a little L and like put them on the side. Like that is my very favorite. I feel like just like so relaxed, and it stretches out like my shoulders, which is a side effect, I guess. But like, oh, it's my favorite. It feels so
No, but
good.
it's so good.
Yeah.
Yeah.
And I totally uh like understand what you're saying. It's so hard to give blanket recommendations. Like people ask me all the time, like, can I eat this food? Well, like, I don't know. I don't know anything about all the other foods you're eating. I don't know anything about your medical history. And it's the exact same thing for a PT, I'm sure. Like you just it's so painful to give this sort of general advice because every person and human is so different.
Yeah. And one thing I will say on that too is kind of going back to what we were talking about earlier. There is this like culture around like female anatomy that's like, you have to be strong, you have to be tight, you should be doing 100
Yeah.
Kegels a day.
Hmm.
And it is the craziest advice to me because no one does that for any other muscle in their body. But it's something a lot of women have been conditioned to think is like, I need to do my Kegels. I need to Kegel all the time.
Hmm.
So I think that's another reason I'm always apprehensive. They might be great for a lot of people, especially people who've had children. It is something I clinically recommend all the time, but it's not necessarily great for everyone. And enough people have already been told that in their life that I don't need to be one more person who's like Kegel your life away.
Yeah.
Because
Especially since you could be doing them wrong and doing harm.
absolutely,
And it
yeah,
sounds like most people are doing them wrong, you said, right? Data shows.
yes,
Yeah. I did want to talk a little bit about that internal exam,
yeah,
especially since you mentioned a rectal internal exam.
yeah.
Because I think a lot of times people hear the word pelvic floor PT and they think, oh my God, someone's going to stick their fingers in my vagina or in my butt. And like, I don't want that. So I'm not going to go.
Yeah.
What would you say to that?
Yeah, I would say this is almost to a good callback to what we talked about. Like, how do you find a pelvic floor therapist?
Hmm.
If you are seeking pelvic floor therapy, that person should definitely be doing two things, in my opinion. Assessing your pelvic floor. So if somebody hasn't had the training we talked about, and this does unfortunately happen in some like bigger PT like chains and companies, they'll say like, oh, this person needs pelvic floor therapy, like Melanie will just see them.
So you don't want me
And
in your
then
pelvic floor therapy. No.
Melanie's like, oh, let's just do glute exercises because this isn't my specialty, but my
Yeah.
boss told me to see this person. If
Hmm.
you're seeing someone for pelvic floor, they should be assessing your pelvic floor. They should be touching your pelvic floor. Otherwise, they don't know what they're doing. They have no
Hmm.
idea what those muscles are doing. It needs to be looked at. But on the flip side, nobody ever should be asking you something that makes you feel uncomfortable. And there are ways to look at your pelvic floor externally. So you may remember this from when you were pregnant because we
Didn't
don't
do
always do
it.
internal work when somebody's pregnant, but you would like feel from the outside under like their sit bone. It's a lot of deep pressure kind of through your butt cheek, but it's all over clothes. And then you can get kind of a gross idea of how someone's pelvic floor is functioning. You're always going to get the clearest picture the better understanding of somebody's strength and flexibility if you can do an internal assessment. But I have tons of patients who, like, whether it's culturally or they have sexual trauma, or
Mm.
there could be a million reasons. They're like, I don't want to do that maybe ever. And I have a ton of people who come in for the first session. They're like, I don't want to do that today. Like, I didn't know that was going to happen, or I just don't feel like.
Yeah.
And I'm like, that's totally fine. I might be like, it's something we should do eventually
Hmm.
because that'll guide our treatment. But for today, let's feel from the outside, or today, let's skip it and get to it next time. So it's both sides of it where I feel like you've got to look at it. And if somebody's telling you they're doing pelvic floor therapy and they haven't, I would be very
Or didn't at least
skeptical,
bring it up, sounds
or
like.
at least did bring
Hmm.
it up. Exactly.
Yeah.
At the same time, a really good PT in general is never going to make you do something you really don't feel comfortable with.
Yeah. I think
Yeah.
that's good advice for any healthcare professional, right? Like if anyone is making you do anything or eat something you don't feel comfortable with, like that's just a bad practitioner and I would just find someone else.
Yeah, totally. Yeah.
Yeah. Yeah. Um, okay, so we kind of talked about this again, but you have some wonderful notes that I want to make sure we got to. So, what are the signs that you have issues with your pelvic floor, or who should see a pelvic floor therapist, right? Like, I think,
Mm.
um, we're people may be wondering, like, why in the world do I have yet another physical therapist on my kidney stone podcast? But I think that there are so many things that honestly, just the general population could benefit from pelvic floor PT. So what are some things, some signs that someone should come see you or or a different pelvic floor PT?
Yeah, I would say one, before I forget it, another thing we could link to people is there is like a screening tool that was created by one of like the forefront like researchers and practitioners in pelvic floor PT. And it's free and it's like easy to use. It's a survey of a bunch of symptoms. And if you
Awesome.
have three or more, it has been shown clinically that you have pelvic floor dysfunction. So we can like, drop that to people
Yeah,
and they could look at that if they're unsure.
absolutely.
But my number one thing I always tell people is if you have any of the symptoms we mentioned earlier, anything related to toileting, anything related to pelvic pain, anything related to like excessive pressure down on your pelvic floor, and you're unhappy about that, you should get it checked out.
Yeah.
I think the odds you work with somebody who's like, I think that's unfixable. Like it's min to none. If something is really bothering you, if you have a symptom that's disrupting your quality of life, a pelvic floor PT is going to know a way to either improve it or help you work around it, because that is what we're trained to do.
Hmm.
Um, so that's what I start with. Even if to you it feels like the smallest thing, or you told your friends about it and they're like, whatever. If it's bothering you,
Hmm.
try and get help for it. That I feel very strongly about that. Um, but then the other thing, like I said, is like some of these like multi-system things your pelvic floor does. If we break it up broadly into like bladder, bowel, and pain, if you're having symptoms in a couple of these buckets,
Hmm.
it is likely at least that your pelvic floor is contributing to it, if not the sole reason it's happening.
Yeah.
So if you're kind of getting like some bowel symptoms, some bladder symptoms, you have pain around your pelvis, if a couple of those things are going on, your pelvic floor, I can tell you right now, is just not happy. And you want to
Hmm.
fix either the way you're forcing it to move, the habits you have, or some other lifestyle factors like we've touched on that are irritating it kind of from the inside out, whether that's your bladder or GI. And if that isn't in the scope of pelvic floor PT, your pelvic floor PT will refer you to somebody
Hmm.
um, who could help you with that part of things.
Hmm.
Yeah.
Yeah. Yeah, I think that's like the most amazing thing in my experience of about seeing a PT in general, because that was my first PT experience at all. And it was
It's a good
just
sign normally.
yeah, yes. Yes, for sure. And like it was just so amazing when, especially during pregnancy, which is like not, the easiest thing in the world, especially twins. And like just have someone listen and be like, "Oh, there's something we can do about this," right? Like I would have shooting pain, back pain, hip pain was the most like consistent thing I had during my pregnancy. And Erin, the other Erin that I worked with actually before
Yep.
before having babies, um, would actually care and not just say like a doctor typically would be like, well, you're pregnant, of course it hurts. Like, right. I feel like that's typically the reaction you get. And she would
Yeah.
always have something to at least try to make it better. Was I totally pain free? No, obviously. But there was definitely things that I could do to make specifically that hip pain, because that was terrible, better.
Yeah.
And I think whether we're talking about pelvic floor stuff or probably any part of your body, just like go see a PT and there's a 99% chance there's something that they can do to make it at least better for you. Is that fair?
Yeah. Oh, 100%.
Hmm.
And like I said, most PTs, most practitioners in general who really care, if like your PT, if you get a sense that they're invested in like your journey, whatever that is, I bet they have a bunch of resources to refer people out to,
Hmm.
whether that's like massage therapy. That's just something like in a PT session for 45 minutes, we don't have a ton of time for. We try to mix it in where it feels really critical, but that might not be what we can do for 45 minutes.
Hmm.
Or a dietitian. I refer people to like dietitians all the time.
Hmm.
um, or whatever it is and whatever body part it is. I feel like if you're working with somebody who's like invested in your care, and for the most part I am biased to think PTs tend to be, because we see our patients so often. So
Hmm.
versus your physician who sees you once a year
Once a
for
year.
15
Hmm.
minutes, I see my patients once, sometimes twice a week for 45 minutes for 6 weeks. Like I'm
Hmm.
in. And so even if I feel like PT isn't the place they need to be or the thing that's going to help, I have so many resources, whether it is another doctor or, another specialist who I can be like, maybe try this instead.
Hmm.
So I agree with you. If there's something that's bugging you,
Just
you can get
come and
connected.
see. Like, what's the worst case
Yeah.
scenario, right? They say
Yeah.
no, there's nothing we can do for you. The chances are so low. But even if they
I
do,
agree.
well, now you know, right?
You already tried. Yep.
Yeah, yeah. I think PT is so often, at least in my mind, was like only something that you do when you like break your knee or like
Yeah.
something, right? Like some sort of acute thing. And like that's so not the case.
Mhm.
And I think the other thing that's really important to acknowledge is that I think that we live in a culture of sort of minimizing any pain and normalizing it.
Yeah.
I think especially around a lot of the pelvic floor PT things, like the first thing that comes to my mind is that bladder leakage. It's like, oh, haha, you're a mom, you're jumping on the trampoline, of course you're gonna pee. Like, well,
Yeah.
no, you don't have to.
Yeah.
Right? There's
Totally.
things that we can do to make that better. And so back to your point, Erin, like if there's something that is impacting your quality of life, I'm not saying like every single ache and pain you go see PT. Like that's not what we're saying. But if there's something that is consistently impacting your quality of life and your happiness, go and see someone and see if there's something you can do. Because
Yeah,
there probably is.
absolutely. Um, the other thing I feel like I would be bad for the profession of PT if I didn't mention too, but I think a lot of that attitude of like, I broke something, I sprained my ankle, my doctor told me to go to PT, I went to PT, I was done with PT. That kind of is like a very traditional way PT used to function. You'd have to see your doctor, they tell you you needed it. They would oftentimes say how much you needed, and then you did it, and then you were done, even
Hmm.
if you didn't feel better. Um, I should know this off the top of my head, but in 48 states, so most of them, there is direct access to physical therapy. And that's true in Illinois. You don't have to go to your doctor to get them to approve PT unless your health insurance explicitly said you had to. And even then, your PT company normally handles that paperwork on the back end. We fax something to your doctor, we get it taken care of. So I also think that is an important thing for people to know, is like it doesn't have to become this like really long process where it's like
Hmm.
my
The
back's been bothering
doctor
me.
sort of controlling it. Like you can take control of your health.
Exactly right.
Hmm.
Like I had this ache and pain, but then I'd have to go see my doctor. Well, it takes 3 months to go see them. If you have, like we're talking about, something that has been consistently bothering you and it's in physical mobility, muscle, bones, tendons, you can just walk into a PT office and take control of your healthcare, which is such a pivot shift for patients and like
Hmm.
customers who pay for their health insurance can now be like, this is how I want to use it. So I also think that is so important to know, but so helpful for changing how people are starting to think of PT,
Hmm.
instead of like saying this like old paradigm, which was absolutely true of like,
Yeah.
something's broken, I go to the doctor, I do the PT, I'm done,
Yeah.
is very outdated and like doesn't work for most people.
Yeah. Yeah, that's so true, especially as like knowledge has evolved so much in all areas of healthcare, right? Like no longer can a doctor know everything. Like they never could, but even more now, right? Like there's so
Right.
much. Like I specialize in kidney stone nutrition. Like how painfully specific is that? Like if you wanted me to talk about pediatric, I don't know, something like you would not want to talk to me at all. I would have no idea what I'm talking about, right? Like that's why specialists exist. And I think as as our knowledge grows as like the healthcare profession, more hopefully more and more of this will happen. Like we will be delegating to different specialists, and the doctor may not even know that these things exist, and it is totally okay for you to go and see. Same thing with a dietitian. Unfortunately, insurance coverage is not as great with dietitians, but sometimes it is covered, and there's always pay out of pocket, right? And like you don't have to go see a doctor to go see a dietitian or go see a PT or OT or speech therapist or like
Yeah.
literally any of the many wonderful allied healthcare uh, practitioners that exist.
Yeah, totally.
Thank you, Erin, so much for your time. I think this was fascinating, and I'm sure it'll be super helpful for our listeners. Where can people find you to connect with you, especially if they happen to live in the Chicago area?
Yeah, so if you're in Chicago, the clinic I'm at is called Westtown Physical Therapy. On Instagram, we're at Westtown PT. I'm here, Bianca's here. Our owner is a physical therapist. She is also a pelvic floor physical therapist. So she is passionate about this. She hires people who are passionate about it. So it is always a great place to look for if you're in the area. If people want to reach me, I have like a professional Instagram. I don't post on it often, but it's there. So former patients and people who are interested could reach me. And that's at E_the DPT, which is
Awesome. And I will link to both the Westtown PT and Erin's personal professional Instagram handles if you'd like to reach out with questions. So
yeah,
thank
absolutely.
you. Thank you again, Erin. This was wonderful. I'm so
Yeah.
excited for these episodes. And maybe we'll have to have you back. If you think of any other topics that you think would benefit people with kidney stones, please let me know.
Absolutely. Thank you for having me.
Thank you.
Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.